Okay, so for side lying, hip hikes and drops, you're going to be obviously lying on your side. Your bottom knee is going to be up at about 90 degrees, and your top leg is just going to be resting on top of a foam roller like this. And then the second thing I want you to make sure is that your top hip is directly on top of your bottom hip, okay? So in other words, I'm going to move down a little bit here. So in other words, this top hip isn't in front of the bottom hip, or you're not turning away from that bottom hip. You're pretty much directly stacked on top of the other one. All we're going to do here is this top leg is the one that's going to be working, and it's going to stay straight the entire time. And I'm going to use the foam roller to help me learn how to drop and hike my pelvis. So to begin with, I'm going to think about reaching my heel as far away from me as I can. And if you watch my hand here, what you're going to see is that that drops my pelvis, my top pelvis here, down and away from me. Then I'm going to do the opposite. I'm going to think about pulling my heel up towards me, and you'll see how now that will have pulled my top hand up towards me as well. Okay, so if I just do a few reps here, I reach away, and then I reach towards. A couple of things to be aware of with this exercise. Number one, I want this to be a movement up and down, not forwards and backwards. So as you're reaching down and away, try not to let this hip roll forwards or roll backwards. It's just a straight down movement and a straight up movement. Second thing is, you should feel that when you reach your leg away from you and this pelvis drops down, probably a little bit of space now is being created underneath my side, so I can get my hand almost underneath my stomach. Whereas when I pull up, that space is now gone. Okay, so this is affecting the position of our spine. So it's a nice illustration how moving our pelvis in different ways has a big effect on our spine, our rib cage, and the rest of our body.